Hello and welcome back. Today we're going to talk about Chapter 22, which is going to be infections that affect the gastrointestinal tract and the genitourinary system. We're going to follow the path for food here, and so we're going to talk about the dental caries or cavities first. And so I want to point out that literally the tooth is a wonderful place for pathogens to grow because there's plenty of resources like food introduced, and the tooth actually allows for a nice surface for the pathogens to adhere to and form biofilms. So there will be two important things that we should point out here. First off, the pathogens will be biofilms, meaning lots of them will be working together. But the second thing I really want to stress to you is this idea that, again, they're not eating the tooth. Instead, they're eating the food, producing waste products like acids that dissolve or break down the tooth. And so that's exactly what we see here. Notice in those low-lying areas, those places where, again, it may be more difficult to remove the biofilm by brushing, we can see this overaccumulation of pathogens that then slowly but surely eat their way into the tooth by producing acid as waste. So literally, plaque is a biofilm, and just like we've discussed before, that one of the best ways to remove biofilms is scrape them off. So here's again that summary of caries or cavities. So let's move on to mumps. Mumps is going to be again an issue that we see out there that is going to have specific signs and symptoms, including fever, nasal discharge, muscle pain, malaise. Why we're talking about it here is it typically causes inflammation of salivary glands, allowing for this swelling ultimately of things like the cheeks and around the face. And so naturally this poor kid is the poster child for mumps, and you can see again that swollen appearance in and around the face. I want to point out that this can move around though and affect things like testes, ovaries, thyroid, pancreas, meninges, heart and kidney, and really again can have some issues with causing sterility if it makes it to the testes. So mumps, again, very important to avoid, and as a result, again, the MMR vaccine was produced to do exactly that. And here's that summary sheet again for mumps, which was again a perimyxiovirus. So let's move on now and make our way to the stomach, where we can see things like gastritis and gastric ulcers. Gastritis is going to be, again, inflammation of the stomach. So we have this pain in the abdomen, really. And really, this can be caused by a variety of things. But one of the things that we want to talk more about is gastric or peptic ulcers. Gastric or peptic ulcers are actually going to be lesions in the mucosa that leads to, again, issues with the lining becoming inflamed or, again, physically harmed. And so the idea is this, for a long time, was thought to be caused by stress. But really nowadays we recognize that most cases are actually caused by a bacteria known as Helicobacter pylori, or H. pylori. And believe it or not, this is a super common thing that just needs given an opportunity to cause serious infection. And so again, stress may be something that does promote the likelihood of this occurring, but it's not the sole cause. Again, the actual cause here is the bacteria. I do want to point out that this is going to be treated with antibiotics. So if you do get diagnosed with ulcers, literally antibiotics are often the prescription that you need. So here's that summary of, again, gastritis and gastric ulcers. You know, we don't really know the mechanism of transmission, but we do know it's super common. So let's move on to diarrhea. So diarrhea, there's going to be a lot of this, okay? I mean, a lot of different bacteria, but also a lot of diarrhea. The illustration here, though, is whenever we talk about diarrhea, it's going to come into two forms here, acute and then chronic. So we're going to start off with acute and talk about the different things that cause acute diarrhea. And again, depending on the organism, we'll determine whether or not we have vomiting. And so we'll go through this and again talk about all these different pathogens, but the idea is they'll cause diarrhea. So let's define diarrhea, which will be 3 or more loose stools in a 24-hour period. And I want to point out that as far as the average that we expect in the United States, it's around 1 to 2 cases per year. But whenever we start talking about underdeveloped countries, again, especially in the tropical regions, we start seeing episodes of up to 10 times a year. And believe it or not, there are 3 million children that die every single year because of diarrhea. So I want to stress to you guys that, again, diarrhea is not something we are concerned with here, but in the rest of the world, it's a major concern. Naturally, food and water tends to become a common pathway in for these pathogens that cause diarrhea. And so whenever we talk about this, food safety was one of the topics that really comes up. And so one of the big things that was going on for quite a while here was Healthy People 2020, which is trying to make everybody healthier over time. And unfortunately, whenever it came to food safety, we've seen some significant declines. Overall, Campylobacter has become, again, more common. Things like E. coli 0157H7, though, has become less common. Listeria stays constant. Salmonella stays constant. Vibrio, which is often found in things like water, has gone up significantly. And then Yersinia, which is the plague, has actually gone down. The illustration here is things do change, but the threats are always there. So eating properly prepared food and, again, treated water are very necessary in staying healthy. So let's move on and start talking about some causes of diarrhea, specifically acute diarrhea. So let's start off with Salmonella. Salmonella is going to be, again, a gram-negative enteric bacteria. So whenever you see enteric, think of the intestinal tract or the gastrointestinal pathway. And this is actually going to have the ability to ferment lots of sugars and produce gas as waste. They also produce H2S, but not urease. And so the idea here is, again, there are multiple products that can be used for identification of Salmonella species. And that, again, hopefully you guys saw that in your unknown project. So let's talk about the signs and symptoms associated with this. Salmonella is going to, again, cause significant issues like diarrhea. But we can also have things like fever associated with this, and even potentially septicemia. I do want to point out that there are roughly 1.2 million cases every single year and around 500 deaths due to Salmonella. I want to also stress, again, IDs. I know we talked about it in the past, but I want to remind you that overall ID is infectious dose, and ID 50 illustrates what the average is. The reason Salmonella cases, although are there, aren't extremely high is because it takes such a high infectious dose to cause infection. So let's move on to Shigella. Shigella is going to be a gram-negative rod. It's going to be non-motile and a non-endospore forming. There are going to be several different species of this, including dysenteriae, which causes dysentery, which, again, if you don't know, dysentery is significantly bad, which is often marked by having blood in the stool. So diarrhea with blood is often called dysentery. The idea, though, is dysenteriae is a version of Shigella that causes that very significant problem. Sodium flexneri are going to also cause issues, but they tend to be much less severe. So what we see with this one, Shigella often causes frequent watery stools, fever, and intense abdominal pain. And again, if it's bad, like dysentery, it will cause blood to develop in the stool. So what causes these problems? Well, two of the bigger issues here are the enterotoxin and shigatoxin. The enterotoxin is going to affect basically the whole GI tract and damage the mucosa and villi, which can give rise to bleeding. But the shigatoxin is actually much more significant because it will straight up destroy the gastrointestinal tract and ultimately could lead to systemic effects as well. So here we have the illustration of a healthy colon on the left. Again, very clean, nice, doesn't look inflamed in any way. On the right, though, we see this very bloody, red, inflamed colon, all because, again, from the toxins associated with Shigella. So let's talk about now the shigatoxin producing version of E. coli called E. coli 0157H7, which, as we've discussed before, is the more dangerous version of E. coli, right? And so this is going to have a varying range of effects The idea, though, is the worst case scenario is that bloody diarrhea that could lead to something known as hemolytic uremic syndrome, which is going to be severe hemolytic anemia that can cause kidney damage and ultimately failure. And so there is this connection that 0157 in particular could even cause kidney failure. Again, that Shiga toxin is what we're seeing is produced here, and most likely the Shiga toxin was being introduced to this version of E. coli through horizontal gene transfer. So most commonly we see this through food, so undercooked beef, fruits and vegetables that have not been properly washed or cleaned before consumption. Again, these are places where we see E. coli 0157H7 being a true concern. There are going to be other forms of dangerous E. coli, but these are going to be, again, kind of situational styles, like traveler's diarrhea that's enterotoxigenic, or even, your enteroaggregative E. coli, which is specifically people that have significantly weakened immune systems. So I wouldn't stress a huge amount about these. But let's move on to another pathogen, in Campylobacter. Campylobacter is actually going to be super common in the United States in terms of causing diarrhea. With this, we do see frequent watery stool, fever, vomiting, headache, and even severe abdominal pain. And this one could potentially last significant amounts of time, upwards of 2 weeks, which now allows it to become chronic or maybe even reoccurring. This is going to have a very interesting shape to it. It's going to be a rod, but it's going to be kind of a curved or spiral gram-negative with a single polar flagella. Let's talk about another pathogen, in Clostridium difficile, or C. diff, as most people know it by. This is going to be a gram-positive endospore-forming rod that will actually be found pretty commonly inside of people. People will often call the disease C. diff, but the disease is actually called pseudomembranous colitis, and it's typically associated with antibiotic use that kills off the good bacteria, allowing for now C. diff to grow out of control. Again, the competition is what usually keeps C. diff levels low, and so whenever we lose competition in the gastrointestinal tract, now we see cases of pseudomembranous colitis develop. There are two major toxins that actually cause most of the problems here. Enterotoxins A and B, which will often cause serious damage to the cells that line the intestinal tract, including necrosis or death of those cells. So treatments, again, include things like the withdrawal of current treatments and replacement of fluids, but we also see, again, fecal transplant is being the more potentially effective treatment that's come to light. So here's some images that illustrate, again, the progression of the disease. So you can see healthy colon, very unhappy colon. So let's move on to another pathogen, which is Vibrio cholerae. And with a name like that, again, it tells you a lot about it. Vibrio meant bent rod. And as you can see, again, these rods have a C shape or a bend to them. We also see cholerae in reference to the disease it causes, which is cholera. This is going to be commonly found in water in places that are not receiving appropriate water treatment. And the result then is the formation of vomiting and then copious amounts of watery stool, often with a kind of a whitish haze associated with it, and that's why it's also called rice water stool. The illustration here is, again, significant diarrhea. We're talking fluid loss up to 1 liter per hour. Naturally, again, this could lead to significant amounts of dehydration, which, again, the usual source for this is untreated water. And so you keep rehydrating someone with this dangerous untreated water, and you see this kind of just relapsing cycle that can cause death. And so the mortality rate on this one is quite high, around 55 to 70%. So let's talk about one of the dangerous features here with cholera, which is the cholera toxin. The cholera toxin is actually going to allow for basically this push of electrolytes from the cells that line the intestines into the intestinal space. And so the idea is we're dumping all these electrolytes or solutes into the colon. And as you're probably well aware, when we push all these solutes outside of the cell, water is going to quickly follow. and as a result we see again that formation of excessively watery diarrhea that has that kind of hint of white or cloudiness because of all the electrolytes associated with it. I want to point out that transmission again tends to be coming from tainted water, and so that oral rehydration therapy to fix this is actually very effective as long as we're not giving the patient again the same tainted water. So let's move on to another threat, but this one's going to be a protozoan called Cryptosporidium. Cryptosporidium is really in here because I want to point out that it is going to be an intracellular parasite, but this also survives highly chlorinated environments like pools. And so the illustration here that even normal regimens of chlorination typically don't do a great job of removing this. That in fact, whenever we see patients developing these cases, we have to go back and look at all the swimming pools they went to so that we could remove the threat by hyperchlorinating that pool. So that means it's shut down for a long time. And anybody that has visited the pool recently should be tested to see if they have Cryptosporidium. So here's some illustrations of, again, Cryptosporidium, again, actively hanging out and invading essentially the intestinal mucosa, again, allowing for that infection that we see. Let's move on to some viral causes of, again, acute diarrhea, including rotavirus, which will be a double-strand RNA virus that is going to have the ability to cause significant infection. And ultimately, again, this is going to lead to many cases, around 2 to 3 million cases, with about 70,000 hospitalizations required. This will be fecal-oral transmission, and ultimately, again, a major threat to typically very young children that are not vaccinated. And so the idea, again, rotovaccine, or the Rototec, is actually one of the earlier vaccines given to prevent this type of infection that leads to significant diarrhea that could kill kids. But let's move on to another virus, and norovirus. Norovirus is actually going to be a super common cause of foodborne disease in the U.S. What's often referred to as things like food poisoning could potentially be things like norovirus. There is such thing as food poisoning, but food poisoning is very short term. So norovirus typically lasts for 3 to 5 days, including vomiting very early on and low fever. What makes this particularly dangerous is the low infectious dose. This thing, again, only requires one virus to actually make someone sick. And so since this is spread fecal-oral, if that one person that is sick touches or handles food, you can have huge outbreaks like what's been seen on things like cruise ships. This has become so problematic that cruise ships have been literally called to port early because everybody became ill with norovirus. So here's that summary of, again, all these different bacterial causes of acute diarrhea, so you can look through them. Here's a continuation here of, again, those acute causes. And here's another one. Oh wait, there's more. Alright, so we just mentioned a second ago food poisoning. So let's actually talk about this, because food poisoning is actually going to be nausea and vomiting accompanied by diarrhea, but will, again, be coming from food specifically. And the idea here is this is often not an actual infection, but rather an intoxication, where ingestion of toxins that have been laid upon the food now causes those signs and symptoms that include nausea and vomiting, as well as diarrhea. So let's talk about one of those that commonly we see, which is Staphylococcus aureus exotoxin. This thing, they're going to list specific foods. I don't care that you worry about that. I care more that you kind of understand that this is a real possibility. Again, since staph loves salty environments, this would be more commonly found in salty things. But really, this enterotoxin is interesting because it's very heat stable and works typically very quickly. We can see the onset of the food poisoning between 1 to 6 hours, but again, will not typically last longer than 24. And so the idea that very quick onset, but very quick resolution as well. And so this should be self-limiting. There's no actual infection. It's just toxins causing the problem. And so literally no need for drugs on this one. Just let it run its course. Bacillus cereus exotoxin is another thing. The Bacillus cereus, again, is going to produce this toxin that can cause vomiting, but diarrhea is also the major concern here. And as I said before, very short-lived and very quick onset usually. So let's move on to another one with Clostridium perfringens exotoxin. Again, this is going to be something that causes significant diarrhea, but often significant abdominal pain and nausea as well. And again, very quick onset, very quick recovery. So here's that acute diarrhea with vomiting caused by exotoxins. Food poisoning is really what it is. So let's move on to chronic diarrhea. Because chronic diarrhea is diarrhea that's going to last longer than 14 consecutive days. There can be, again, infectious or non-infectious causes for this. And naturally, again, our concern would be the infectious things here. I want to point out that AIDS patients will absolutely have chronic diarrhea. In fact, chronic diarrhea becomes the normal once you're diagnosed with AIDS, because even what would be considered to be good bacteria are now causing problems. So let's talk about some of the causes for chronic diarrhea, including Cyclospora. Cyclospora is going to be a more commonly showing up pathogen here in the US and Canada, actually. And the idea is this thing's fecal-oral transmission, as with many of these things, and the oocyst actually will fluoresce in such a way that allows them to be spotted using UV light. So you could kind of check feces for the presence of the Cyclospora. But really the symptoms here: watery diarrhea, stomach cramps, bloating, fever, and muscle aches, again for multiple weeks. Another common cause of, again, protozoan diarrhea here in the United States is the pathogenic flagellated protozoa called Giardia. Giardia is going to be something that can be commonly found in natural reservoirs that have not been treated. And so we again see this being found in things that would interact with this, including things like beavers and cattle, natural wildlife, even humans. The idea here is that this protozoan will actually hang out in the upper part of the intestinal pathway, which would interfere with the breakdown of fats. And so one of the common things that we see here beyond long periods of diarrhea and abdominal pain is flatulence, greasy stool, as well as malodorous stools. The idea here is that disruption of the breakdown of fats allows for a greasy, disgusting kind of stool. So let's move on to entamoeba, again another protozoan cause, this one though being an amoeba. This thing is going to have intestinal and extraintestinal forms. I do want to point out that this thing does target things like the cecum, appendix, colon, and even rectum. The idea is that this thing can actually penetrate and get into other areas and cause, again, issues like dysentery through that penetration. So we see things like diarrhea, fever, abdominal pain, weight loss, even again significant hemorrhaging or perforations that can happen. The idea, again, entamoeba can be very, very problematic to hosts. So let's look through here again of the chronic causes of diarrhea. Again, we focus primarily on those things that were protozoans. So here's a continuation of the protozoan causes. Alright, so let's move into inflammation of the liver, which is hepatitis. Hepatitis, again, as the name suggests, is literally the hallmark is inflammation of the liver. But there can be, again, differing levels of effectiveness based off the different versions of the hepatitis virus. We do see things like necrosis of hepatocytes, which naturally, again, would lead to a decreased function. And so we see things like basically the excretion of bile pigments that causes bilirubin to accumulate. That leads to jaundice. So jaundice is commonly associated with hepatitis. The idea here, though, again, all hepatitis will cause some degree of inflammation and damage to the liver. The question is how much. So let's start off with hepatitis A. Hep A is going to be a non-enveloped single-strand RNA virus that has very vague or minor symptoms. Again, many of them kind of flu-like, and typically doesn't present with jaundice. And so the idea is many people aren't really that aware that they have Hep A. What's interesting about Hep A is it's actually transmitted via the fecal-oral pathway. So we see outbreaks associated with food preparation, like Red Robin. The idea here, though, is there are immunizations available. So again, after the outbreak here in Springfield at Red Robin, immunizations were administered to prevent this from becoming a serious problem. So let's talk about hepatitis B for a minute here. Hep B is an envelope DNA virus that has, again, a little more serious signs and symptoms, including fever, chills, malaise, anorexia, abdominal discomfort, diarrhea, nausea. But really where this one becomes much more concerning is it does increase your risk of hepatocellular carcinoma, or again, cancer of liver cells. The idea, though, is this one is transmitted via blood and not fecal-oral. So this one is something that usually is introduced through things like needle sharing or accidental sticks, like in healthcare workers. The idea here, again, protection against Hep B is very, very important. Hep C, though, is one that we're very concerned with. We actually think this is something that is far more common than people realize. So we actually refer to it as being a silent epidemic. It's speculated that around 3.5 million Americans are actually infected, and a good chunk of those people don't even know it. So we have the similar features to Hep B, but ultimately, again, the likelihood of clearing this one is basically none. Transmission, typically blood and potentially sex, and so the idea here, Hep C, something that many people could have and most likely have been exposed to in the past. There currently is no vaccine available, but there has been a new two-drug regimen introduced to allow for basically the removal of the majority of this virus, which again helps with the problem. So here's that summary of hepatitis. One of the ways that I memorized because there's lots of hepatitis out there, one of the ways I remember Hep A and even E here is they're transmitted via the fecal-oral pathway. And so I memorized this by thinking about the channel A&E. A&E has crappy programming. And that way, again, I can make that connection that A and E is the fecal transmission for different types of hepatitis. So let's start getting into some of the worms that cause issues in the intestinal pathway, including the pinworm Enterobus vermiculus. The pinworm, again, we've already discussed before, typically does, again, infect children. Again, transmission tends to be fecal-oral. So the idea, again, this does cause that very characteristic anal itching, which allows for the picking up of the worms, eggs on the fingers, then can be spread to the mouth or to other children. So let's move on and talk about Ascaris. Ascaris is often commonly known as the giant roundworm. These things, again, are very large, but really the bigger concern here is they become very overwhelming in numbers. And so this actually can allow for some bigger issues, in that it can cause things like the blocking of the bowels. We can also see it can penetrate in the intestinal wall and then enter the lymphatic system and into circulation. Can lead to things like issues in the heart or even lungs. And so ultimately, again, this worm particularly dangerous. So let's talk about the tapeworm for a second. The tapeworm, again, typically looks like a flatworm, looks like tape. The illustration is they get very, very long. Adult worms can be upwards of 5 meters in length, and they're found all over the world, but can be found in different sources. Primarily, again, food being the primary place we find these. So like cattle, pigs, and the eating of undercooked foods leads often to infection. So let's move on and talk about some other versions of worms and flukes. Ultimately, again, these things are liver flukes that we're going to talk about. These liver flukes, again, would typically want to occupy the liver, as the name suggests. And so ultimately, naturally, that could cause lots of issues, including the formation of granulomas in areas of the liver. Bile bile duct blockages are also something that is possible. Another form of the liver fluke is fasciola hepatica. This one is commonly associated with, again, meats. This one often spread and leading to symptoms like diarrhea, vomiting, hepatomegaly, which is an enlargement of hepatocytes or liver cells, or even, again, that bile obstruction, as we said before. So here's the overall summary of the different dangerous organisms associated with the GI tract. Here's again the gram-negative bacteria. Here's again the viruses and protozoa. And then our worms. And lastly, again, worms. And here's that image, the visual summary of the different threats. So let's start talking about things that affect the genitourinary tracts, including, again, things that cause UTIs. E. coli is going to actually be the leading cause of UTIs. Again, somehow E. coli from the gastrointestinal tract gets introduced in the urinary tract. And the idea here, again, that allows for the movement of the bacteria up the urethra to the bladder, again, causing that bladder infection. There are multiple ways to decrease the likelihood of bladder infections, including frequent urination, but one of the things that's actually been shown to work pretty effectively is the continual use of things like cranberry. Cranberry decreases the likelihood of attachment in the bladder, and thus a decrease in risk of infection. So here's again things that cause UTIs. So let's move on to inflammation of the vagina. Again, there can be several causes, but the ones we'll talk about are yeast infection caused by Candida, and then Trichomonas vaginalis, which again is a protozoan. The signs and symptoms here, again, of inflammation of the vagina, with including itching, burning, or even discharge. So let's talk about, again, the fungal causes, including Candida albicans. Candida, super common out there. We see it in basically almost every person, whether it be in the mouth, GI, or the vagina. This is something that can be detected via a gram stain, and so we see oftentimes there's pseudohyphae associated with this one, and ultimately these can grow into colonies or masses that kind of look like curds, and so that would be also a visual indicator of this infection. So let's talk about Trichomonas vaginalis, which is a protozoan cause of vaginitis. This is, again, a flagellated protozoa with also an undulating membrane. This thing is pretty commonly seen out there and is spread via sexual contact. It can cause a white or green frothy discharge, or even in pregnant females, a premature labor and ultimately low birth weight of the infant. So here's that summary of, again, the causes of vaginal inflammation. So let's talk about some signs and symptoms of gonorrhea. With gonorrhea, males are typically going to be asymptomatic, but if they do have symptoms, that includes inflammation of the urethra, painful urination, and even discharge. Females, on the other hand, typically do have symptoms, and they'll often include things like a nasty vaginal discharge, including blood, or even painful urination. What's more concerning here is untreated cases in females can lead to inflammation of the fallopian tubes and ultimately into pelvic inflammatory disease, which can lead to sterility. I do want to point out that there is some risk to children being born to a mother that is actively carrying gonorrhea because it can cause an eye infection that can lead to blindness. So here's that idea about the inflammation that can result in a failure to reproduce effectively. So you can see here, again, we have the tubal pregnancy as one of the options here. But like I said before, even again, the infertility is a real concern. Here's an illustration of the eye infection caused by gonorrhea. So what causes gonorrhea? Well, it's a bacteria known as Neisseria gonorrhoeae, which is a gram-negative diplococci. This is found out there, but again, most commonly transmitted via sexual means. This is something that can survive for long periods of time in the body due to phase variation, but the idea is, again, treatments are effective, except for an illustration that happened in 2011 whenever a strain of resistant gonorrhea was discovered in Japan. So let's point out a breakdown here of gonorrhea and chlamydia incidences broken down by age groups, and you can see a pretty consistent pattern. Those most likely to be experiencing gonorrhea or chlamydia really tend to be in the younger age brackets. Those people that are often inexperienced and new to sexual encounters, and thus often don't take the protections that they probably should. So let's talk a little bit about chlamydia. Chlamydia is actually one of the most common notifiable or reportable infectious diseases in the U.S. Unlike with gonorrhea here, males will typically have signs and symptoms, including discharge and painful urinations. The females, on the other hand, tend to be those that are more likely to be asymptomatic. If they do have symptoms, it would be inflammation of the cervix, even discharge, and potentially the development of PID, or pelvic inflammatory disease. This can spread and cause, again, other problems, but in general, again, we typically think of this as being sexually transmitted. So what causes chlamydia? Well, it's a bacteria called Chlamydia trachomatis. Chlamydia, again, very small and gram-negative bacterium, but what's interesting here is it's an obligate intracellular parasite, and so this is one of those things that can actually invade your phagocytes and prevent the phagolysosome fusion, allowing for it to reproduce uncontrollably within the phagocyte. And if that phagocyte moves around, it can be dumped out in places where, again, it wasn't initially introduced or picked up. So that's a summary of the genital discharge diseases. So let's talk about another commonly known sexually transmitted infection, that is syphilis. Syphilis is well documented throughout history. Syphilis is one of those things that was noted in great detail in historical writings because of how potentially bad it could become. Syphilis, well known for, if being left untreated, progressing to ultimately what would lead to dementia or madness, because this is a spirochete that causes this disease. So the initial infection, again, they would refer to as being primary syphilis. That's often marked by having what's known as a canker, or this red hard bump that appears where the spirochete enters. But the concern was in whenever it spread in what's known as secondary syphilis. And the idea is now it's trying to move about throughout the body, so we see a rash develop often and potentially even hair loss. But whenever things get really bad is whenever we hit latent or tertiary syphilis, which then allows for invasion of important organs, like damage to the heart or even brain, so neurosyphilis, or even, again, the damage that occurs to cartilage or the liver or skin. So again, tertiary or latent syphilis is that real bad stuff. Congenital syphilis is also something else that we're concerned with. Again, syphilis can directly inhibit fetal growth, causing ultimately failures in important points of development. And so ultimately this can lead to fetal abnormalities or even spontaneous miscarriage or stillbirth. So here's some illustration, again, of the kind of introduction sites. So like, as you can note at the base of the penis here, where the spirochete entered, but again, I told you in like secondary we start seeing that rash that develops all over the body. So image B there illustrates exactly that. So here's an illustration of, again, congenital syphilis. Again, very, very, very sad disorder in which, again, syphilis has caused issues in proper development of offspring. So what causes syphilis? Well, it's a spirochete, as I said, known as Treponema pallidum. Treponema is, again, going to be spirochete, or the thin helical bacteria that often are long. Again, the concern with them is they have an endoflagella that allows them to, again, kind of burrow through tissues and move around. They also have a great ability to kind of evade immune response as they move throughout, but can actually encourage strong inflammation, which again allows for issues throughout the body. I do want to point out that overall this is pretty common out there. Again, risk of infection goes up 12 to 30% per sexual encounter. So multiple unprotected encounters again can lead to significant chances of encountering this. So again, using protection is very important here. So barrier methods like condoms, super effective at preventing this. So let's move on to genital herpes, which is again herpes simplex virus 1 and 2. The idea is HSV or herpes simplex 1 usually around the mouth and HSV 2 around the genitals, but these can be interchangeable. Really, it's where did we have the inoculation occur. Just like other forms of herpes, we see again the vesicles presenting on the surface, and just like other herpes, we also see that viral latency that usually occupies again a nerve where it was introduced. Overall, again, herpes is something that is transmissible, but primarily when again lesions or vesicles are present. So one of the concerns with again being a pregnant female about to deliver with herpes is the transmission during birth. And so often again, if there is a herpes flare-up, we would try to not have vaginal birth because the potential of neonatal herpes simplex. This is particularly nasty because it does cause significant issues if it does get into the CNS of the offspring. So we see mortality rates jump up to around 50 to 80%. So again, cesarean becomes very common if again the mother has herpes and is having an outbreak. So let's remind you again, both HSV 1 and 2 can present on the genitals, and it's because again where they were introduced on the genitals allows the virus to become latent, and thus it will keep representing or showing up, reappearing along the genitals. And again, things that allow for this reactivation include things like stress, UV radiation, injury, even other infections. So here's that illustration of again the sacral ganglia being a region where the virus is going to be occupying, and so that virus again can follow that nervous tissue, thus it would keep presenting on the genital region. So again, here's that genital ulcer diseases. Here's a continuation. So let's talk now about HPV or human papillomavirus. We've already talked about HPV, again causing warts, but again since this is about sexual infections, we need to talk about again genital warts. And really with warts, you know what they are. They're going to be growths that appear in and around where inoculation occurred. So naturally in and around the genitals, like the vagina, the penis, the scrotum, the anus. The idea here again is these warts would appear where they're introduced, which would be in this case the genitals. I do want to point out though that we can see this kind of mass of warts that develop that can actually decrease in the functionality of the sexual organs, and so sometimes surgical intervention is pretty necessary. But we've already discussed again numerous times this idea that HPV directly tied to cancer, and it's estimated that around 4,000 women die each year from cervical cancer, many of those cases again being caused by HPV. There's also a huge connection to again many other cancers associated with the genitals, but also throat and oral cancers. The idea is we are all at risk for this, and thus everybody should get the HPV vaccine. So what causes HPV? Well, it's the human papillomavirus. There are some common strains associated with cancer, which include HPV 16 and 18. But overall, again, most of the HPVs have been thought to have some connection to some cancers. So the idea here, most likely transmission, again, like chlamydia and gonorrhea, is very early. So being very cautious and using protection is very necessary. So prevention is really the name of the game here, and one of the best ways we can prevent this is again vaccines. So there are vaccines available, but they're typically pushed at an age before the child would be having sex. So yes, it's at a typically young age, but it's trying to literally protect the children before they have sexual encounters, and thus their likelihood of actually contracting this is much lower. And so the idea here again, early in the administration of the vaccine, and it should again offer protection against the dangerous strains that we know of. Again, every woman should be screened via pap smear by age 21 or within 3 years of their first sexual encounter, again, to make sure that we're not seeing any issues associated with, again, cervical cancers. So one of the last things we're going to talk about here is molluscum contagiosum. This is a pretty weird virus that's actually going to be part of the pox viridae, and it causes wart-like growths on typically associated mucous membranes or skin around the genitals. But what's more interesting is this one is one of the rare things that doesn't have to be spread via sexual contact. This one can be contracted through just physical contact with a physical object, like a toilet seat, for instance. And so these are one of those things that is thought of being sexually transmitted, but is not only sexually transmitted. And so again, this is one of those things that can be picked up just from the normal environment. So here's that summary of wart diseases. Here's a continuation. And that really takes us here to this last thing I want to kind of point out to you guys, and that's the overall frequency of a lot of infections spread sexually in the United States. It's pretty rough to actually think about, but the reality is there's a lot out there that really we do expect to see numerous new cases of all these diseases every single day. The illustration here is, again, you need to be very safe and cautious in your sexual encounters, because it takes one poor decision and you could potentially get an infection that you can't get rid of. Again, things like herpes or HIV, those things are for life. And so again, being very responsible and aware of what you're doing whenever it comes to sex is very necessary. So using protection like condoms is probably the best way you can protect yourselves. So again, be very smart and be proactive and make sure that you're not opening yourself up for infections. So here's that summary of, again, the different sexually transmitted infections. That continuation. And then that visual representation again. I like his pose.